Hi, I'm Kathy. I'm one of the educators at Arthritis New Zealand, and I am very pleased to introduce to you this morning clinical psychologist Kirsty Ross, who has kindly jumped on with us to give us a little bit of information about cognitive behavioural therapy and acceptance commitment therapy, and how that might be of benefit to some of you with chronic pain. So welcome, Kirsty.
Thank you.
Tell us a little bit about yourself and then in a nutshell what CBT and ACT is.
Yeah. Thank you for the invitation. It's really awesome to be here. And I think that your organisation does amazing work, and it's an area, persistent pain, that is something that unfortunately many New Zealanders are going to kind of have to learn to grapple with for a variety of different reasons as we get older. My interest in persistent pain is kind of multiple, really. So I was born with a neurological condition, so I have spina bifida, and as a result of that, I have neuropathic pain myself that I've had since I was very little. So I've had a kind of an interesting experience with persistent pain, in that it's been lifelong rather than a sudden sense of loss. And I'll talk in a moment about what the significance of that is, because it is quite important. Clinically, I've been a clinical psychologist now, working in the field for, I have to think how old my eldest is, 20 years. And I've worked a lot in the area with health conditions. So I've worked a lot with young people and families in whānau, and then, working with people with persistent pain through diabetes or cancer treatments or cancer after effects, or a range of different kind of things, and have just become it's a really interesting area to work in clinically. It really is an area it brings together all elements of someone's sense of self, physically, emotionally, interpersonally, spiritually. So it really is quite it's an all-round sort of impact, and therefore multidisciplinary input is really important when it comes to actually managing persistent pain, and that is definitely the gold standard. So I'll talk a bit about kind of the psychological pieces, but I guess it's important to sort of say up front that typically, as a psychologist, we would be working really closely with other members of someone's care team, whether that's a physio or a medical specialist or an occupational therapist or whoever it might be, to make sure that actually all of someone's well-being is catered for. So it really is important to sort of make sure that all those pieces are in place for good pain management.
Sure, that sounds cool. So in a nutshell, what is CBT and ACT? We hear these acronyms bandied around a little bit. Tell us a little bit more.
So the typical kind of emotions that people feel when they have to, come to terms with pain that won't go away is a sense of adjustment and grief and loss. And that's where acceptance and commitment therapy, which I'll just shorten to ACT for use of ease of use, is really helpful, because there is a part which is actually I can't get rid of this. I need to accept that this is part of my life, and be able to tolerate the emotions that come along with that, which can be a sense of grief and loss, a feeling of it's not fair. And too often in society, we kind of push those feelings away and say we shouldn't feel like that, just get on with it and that sort of thing. But sitting with those emotions and just naming them, being mindful of them, letting them pass, being able to communicate those to people, and just saying, I'm just having one of those days today where this really isn't feeling very fair. It's a really core part of what ACT is. The other part of ACT is both ACT and CBT are very behavioural, in the sense of they want you to do something different in the face of a situation which brings up different emotions for you. So as I said, the key emotions with persistent pain is adjustment, distress, grief and loss, sometimes a sense of sadness, and obviously we need to be mindful that people don't end up slipping into depression. Anxiety is a really big one, and anxiety around experiencing pain or doing something which people worry will make their health compromised or make things worse. So ACT looks at acceptance of the situation and the emotions without trying to, I guess, push them away, to be able to sit with them, but then behaviourally to be able to look at what do I need to do in this situation which is going to enhance my quality of life. So what are my values? What are the things that are important to me in this situation that I'm prepared to do something to move towards those goals? So, for example, it might be that so it might be really important to you to go watch your grandchild play soccer. It's cold right now, so you're kind of aware that that's actually going to potentially aggravate a pain experience because of the environmental factors, and that perhaps some cheering and some physical activity on the sideline may also kind of aggravate that, but that you compensate for that. So you have a nice quiet day beforehand, that you maybe take along a hot water bottle or something to, and somewhere to sit on the side of the field, but that you also allow for the next day that your pain may be aggravated by that, but you accept that as part of the overall package, because the goal is to do something that's really important to you that actually brings a sense of well-being and positive emotions. So that's kind of, I guess it's a very simplified version of what ACT kind of does, but it's really is around living a life in accordance with your values and accepting the emotions as they come up as part of moving towards those experiences. Where CBT is a little bit different. So this is also very behavioural, and it also looks at your thoughts. Both of these look at thoughts and behaviours and emotions and see the link between them. So they're very similar in that fundamental kind of sense that those things are intertwined. What CBT does, and it can be really useful when you have anxious thoughts, for example. So you might sort of think, oh gosh, I've got this pain. Does this mean that I've deteriorated? And it can very quickly snowball into quite catastrophic thinking that perhaps I've injured myself, or I'm going to end up really unwell. Do I need to go to hospital? And a snowballing kind of a sense. What CBT does is it gets you to sort of calm that down through some, again, sort of mindfulness, diaphragmatic breathing, sort of, settle that feeling, and then to look at the evidence for that thought. So it might be that actually you have had this pain before, and that, it didn't mean anything. So there's a difference between harm versus hurt, for example. So something can hurt, but it's not actually harming you. To be able to challenge that and go, well, I'm in a bit of pain right now, but actually when I think about it, I did do a bit of walking yesterday, and that's probably the reason for it. I'm going to sit down quietly. I'll see how this goes. I'll check the evidence that this is kind of catastrophic. And as you sit there and the pain sort of subsides over time, it gives you evidence that catastrophic thinking and those anxious thoughts weren't quite, on first sight, weren't as accurate as your brain was telling you at the time. So CBT is really helpful if you think of your brain as being a little bit like a smoke alarm sometimes. So it'll fire off. And some people's smoke alarms are tuned in to certain stimuli. And will go off very quickly, and to be able to sort of calm yourself down and look around and go, actually, is there a reason to be concerned here? Because we don't want people to completely ignore the signals that they're getting from their body and their brain, but to be able to sort of calm down and look at things and go, is there evidence actually that this is just an alarm, but there's no fire, so to speak. So I think one of the things which I would really encourage people to kind of think about is that CBT and ACT actually, they serve different purposes for different situations. And what we increasingly see is therapists who kind of talk about different situations with their clients and think about what's the most relevant, what's the best tool that I can give you for this particular emotional situation, and how can we weave these things together. So that there are differences between them, which I won't go into too much detail in terms of philosophies and so on, but they actually have different purposes for different situations as well.
Just hearing you describe these different therapies, I have this strong sense that, a lot of our online communities, I oversee a lot of the Facebook groups here, and some strong things about the things that you've been outlining about, grief and loss at the change of circumstance, and that powerlessness around pain and not feeling like they're in control of it. And people spiraling into anxiety and depression seems to be a big feature for people. So that's quite exciting that there's perhaps some things that can help. So how can these therapies benefit someone with chronic pain?
Well, I think the first thing is that just being able to name your emotions and have those normalised is a very important part for people, because as I mentioned earlier, for a lot of people, their pain is something that develops later on in life. So there's a before and an after kind of experience for people, and a sense of, I miss the person I was before, I miss my life before, I miss what I could do before, kind of creates a sense of, there's a term that we often talk about with clients called chronic sorrow, and it's not grief is when there is something kind of tangible that you've lost, and there's a sense of mourning something that's gone completely. Chronic sorrow is it's a slightly different thing, where there's a sorrow that you still have your life and you still have, lots of good things in it, but it's different. And it's much harder for other people to, if you kind of think of persistent pain as being like an invisible situation for many people, and a lot of people have a sense of pride, so they actually work very hard not to display their pain, in public, and to put on a brave face, so it becomes even more invisible. And so to be able to say, I feel really sorrowful that I feel a sense of loss, that I'm not able to do these things in my life anymore, or that I'm not able to do them in the same way, is a very important thing for people to be able to communicate to others. Because when you don't feel heard, when you don't feel understood, it can create a real sense of disconnect with people around you. And that can lead to difficulties in a relationship where someone's in pain, they're feeling really sad that they can't do something, they haven't been able to express that to their spouse just sees them being a bit irritable and grumpy, and then sort of fires back, and it's like, why are you being like this? And then all of a sudden you actually start to sort of develop some disconnect in relationships. So a sense of loss is a very common thing, and it's important that people don't try and support people, don't try and fast forward someone. What we often do is we go at least, or kind of those sort of, I don't know if the audience will recognise this reference, kind of Pollyanna moments, like look on the bright side and look for silver linings and so on. Could be worse, yep. Look at, there are other people who are worse off than you. That really doesn't help. It can help to perspective take, and it can certainly help to engage in what we call positive psychology techniques, which includes gratitude, to be, to look for yourself, not to have other people to tell you what you should be grateful for, because it tends to wind people up. But to have a sense of, actually, I recognise I'm feeling sorrow about this, but actually I feel really grateful that I've got a roof over my head, or I feel really grateful that we're in a position that I could, that we're near the river and I can go for a walk, or I'm really grateful that I have a loving spouse, or that my kids are cool people, or whatever it happens to be. That is helpful for emotional well-being, but it kind of needs to be internally driven rather than other people making you or forcing you to try and see the bright side all the time.
Yeah, that's right. And I think it can be a very isolating journey for people.
Yes.
They're trying to put on a brave face and feel like actually no one really understands. No one really cares, and I can't articulate how it is for me. And so I just won't say anything.
Yeah. And certainly that shutting down is a really common kind of experience for people, that they feel really misunderstood. There isn't the same language to talk about persistent pain as there is with other disabilities. And, sometimes people dismiss it, like, oh, yeah, I have pain too, just like everyone does. But real persistent pain is at a level, it's at a frequency and intensity and a duration which is not typical. And it's incredibly tiring to live with pain. Everything that you do takes more effort than it does for other people. And so you fatigue much faster. So being able to pace yourself is really important, so that you don't vacuum the whole house in one go, you vacuum a room a day, and that, you're given permission to do that. In fact, you're encouraged to do that, rather than to kind of have that invalidated by other people around you, like, well, we've got a small house, why can't you just do it all in one go? Those kinds of things. So acceptance of your emotions and acceptance of the change in lifestyle sometimes and circumstances is really important, but it does involve being able to recognise the emotions that go along with that and to be able to communicate those in a way which bring people towards you as support people rather than have them feel like they just don't get it. I mean, they won't truly get it unless they experience it themselves, but there's a way to connect around your emotions that can really create allies for someone with persistent pain, which is really helpful.
So I can already sense that there might be some real interest and sense of anticipation about this for people. So how does someone access these therapies, Kirsty?
Yeah, so there's a range of different kind of therapists that work in the area of persistent pain, and there are some people who work in specialist services who also do some private practice. So, for example, I have a colleague down in Christchurch who has worked at the Bearwood unit for some time who's got a private practice. There are a number of, I know the places in Palmerston North pretty well, but there are a number of agencies which specialise in persistent pain. So a bit of a Google search can be quite helpful. There's also the Talking Works website, which you can find a therapist through there in your region. I definitely think it's really important to ask people and to know that that's okay about whether people have experience in training in persistent pain. I started learning about this as a clinician maybe 10 years ago, I guess, and it's such a complex area. The biological elements of it are complex. As a psychologist, obviously I'm not a medical person, but to have an understanding of that has been really important. So you do want someone who has attended some professional development in the area. So Talking Works, there's some really good health psychologists in the country, and so having a look at, so the College of Clinical Psychologists has an Institute of Health Psychology. Or perhaps that might be the Psychologist Board, but there's, if you have a look at the New Zealand College of Clinical Psychologists, you can actually search for a clinical psychologist, but there are also health psychologists who work specifically in health, who would be through the New Zealand Psychologist Board, that you can do a search for people to find a therapist through that avenue as well. But Talking Works also has a broader range of type of therapists who undertake this work. There's some excellent physiotherapists, for example, who've done some professional development in CBT therapies and who have some knowledge of that. So it depends a little bit on, I guess, sort of what you're looking for in a therapist as to what their primary training is. So if you really want someone to sort of target the psychological elements, I would definitely suggest a psychologist first. But as I said, there are some physios who actually they've got all the physio training, but they also have a bit of training in CBT as well.
Right. Okay, cool. So I'm a little mindful that some of our audience have quite a lot of outgoings for their health, and some maybe on some benefits as well. What kind of costs and or subsidies are involved with accessing these kind of therapies?
Yeah, it's such an important question. Certainly we have had situations where our local DHB has funded people to come and have persistent pain work here at Mid Central Health. So it is worth having a chat to your doctor about whether there is any funding available. The government has recently rolled out health improvement practitioners within primary care, so within GP services, and they come from a range of different kind of backgrounds as well. And there is often long-term health conditions, specialist nurses within primary care and within GP practices who may have some knowledge of pain management as well. So I guess, starting a conversation with your initial primary care physician and your specialist at the hospital, if you're under a rheumatologist, would be really useful to see if there is something in your GP practice that you can tap into. There are some group therapies, a Stanford program, for example, for persistent pain management that I know is run across the country that can be quite useful. So there may be some things going on within your GP practice that you're not currently aware of. The rheumatologist may be able to see if there's any funding available, and I don't want to promise that, but certainly I know that the rheumatologists are actually very strong advocates for people to get psychological support. The other thing that I would say is that we do have a New Zealand Pain Society, and they actually, on their public-facing part of their website, there are some resources. There's also some very good resources that we use with patients. So I'm not meaning to patronise the audience here, but on the Kids Health website, there's actually, and I know it's about children, but there's a big section on persistent pain, including links to YouTube clips and videos which really nicely explain the physiological, psychological processes, which is actually just a really nice starting point. So it's obviously designed about persistent pain with children, but the fundamentals are really useful. I'd also really recommend a person called Lorimer Moseley, who does stuff on YouTube and online a lot, all freely accessible, about the cycle of persistent pain, and does a beautiful explanation of persistent pain. And I think sometimes it's really useful to sit down and watch with family and whānau, because they don't understand the inner experience. They can watch something and it can create a conversation between people around what that experience might be like for the person with persistent pain, and start to have a shared language around how to talk about things as well. So there's some very good online resources that I would recommend. So the Kids Health pain pages, the Pain Society has some that is not members only kind of login pages. Lorimer Moseley on YouTube. Those would be really good kind of starting points in terms of thinking about having a look at some resources as well.
Okay, that's great. And do you think maybe you can just send those little links to me later?
Yes, yeah, absolutely, yeah.
And my last question for you is, how many sessions might someone need to commit to?
Yeah, so I guess the thing about therapy is that it's our job to create a space for you to be able to, just, I guess, first and foremost vent and, have a space where you can just do the grieving and the emotions, but also start to be able to identify what the emotions are for yourself, so that you can then communicate those to people around you who are your nearest and dearest, as well as health professionals. There are times where people are very anxious, but how that might come across to a health professional is a little bit combative. So, to be able to say, I'm feeling really anxious, I'm a bit wound up right now, to a health professional immediately changes that interaction, because, people see what's on your face. They don't necessarily know what's going on inside your head or in your heart. So when you can actually identify the emotion that's happening for you in that moment, which you can do through practice with therapy, and be able to sort of settle that emotion so you can communicate effectively what you need in that moment, it's a much more helpful and productive kind of interaction for everyone concerned. So that's one function of therapy. The other function of therapy is to teach you skills. Skills to be able to settle your emotions, because when people are very highly emotionally activated, their body goes really tense, which actually creates more of a pain experience. So it actually increases someone's level of physical experience of pain when they're actually distressed. So the interplay between the mind and body is really strong. So to be able to calm your body down actually means that not only can you communicate and sort of think about what do you need to do in the situation, but it may actually relax your body and it may actually help with the pain that you're experiencing. So calming your body down, and then being able to use some strategies to look at your thinking, either to moderate your thinking if it's kind of that catastrophic thought, to sort of balance it out a little bit with some CBT techniques, or to accept a worry or a thought that you can't necessarily change. It's valid, it's real, but at the same time you want to be able to do something different in that situation and not just act on your worry. So you want to be able to move in line with your values. So that's where the teaching of some skills is really important. And what we tend to say to people is it's great if we could kind of have a sense of having a plan of maybe we often sort of think about 6 sessions as being a package of care that people, can really sort of learn some emotion regulation, distress tolerance, and behavioural strategies within those 6 sessions. That's a very broad guideline, because some people actually don't need that many, and then some people have some quite complex situations that do need more. But I think I would always say to someone that if you go to see a therapist, if you are in a situation where you may only be able to afford 1 or 2 sessions, what I would say is to be really upfront about that. As a therapist, I would never be offended by that. What it would do is give me a sense of, so I'm going to need to give you a whole lot of stuff to take away that you're going to be able to put into practice in your life. That means that I've given you something useful within those 2 sessions. So I'll teach you a core skill in those 2 sessions, and then I'll give you some other things to take away and build on for yourself, and maybe link you in with a support group, or kind of to enable you to keep moving forward in terms of your own quality of life. So, if you are in a situation where you could only afford 1 or 2, please let your therapist know that, and plan together about what would be one key thing that you could get out of those couple of sessions that would really make a difference to the quality of life and and your pain experience.
Hey, Kirsty, I know we've only scratched the surface and it's the tip of an iceberg here, but it's been really helpful just to have a brief conversation with you, get a few ideas about what CBT and ACT is, because I know a lot of people will have heard this, or it's just raising it into people's consciousness that it is something that possibly might help, that they may be able to access, and you've outlined how they could maybe look into whether it's something that they might be able to access for them in their own area. So I really thank you for taking the time to have a chat with us, and it would be great maybe to talk on some other topics again in the future, but
yeah,
I'll have a chat with you about that.
Yep, no, that would be great.
So thanks for joining us today.